Do you trust the government with control over your healthcare decisions?
Hear one woman's story of what the government did to her without her consent.
At the age of 13, I became pregnant. I was raped by a guy that lived across the street from me. When they was delivering my son, they sterilized me at the same time. They had approached my grandmother and said that if she wanted to continue to receive supplement, welfare, and food stamps, and said that if she did not sign the X, that they were going to stop her supplements. My grandmother was illiterate. She didn't understand what it was. So she signed the X, and they did this to me. I did not find out that they had sterilized me until I was 19 years old. I asked the state of North Carolina why they did this to me, and they said that because I was feeble-minded, that I would not be able to take care of myself, I would not be able to tie my shoes, that I was just incompetent. They were saying that feeble-mindedness is hereditary. So they sterilized me so I would not produce my kind. Mind you, I am not illiterate, nor am I feeble-minded. I never went into high school, but yet I still acquired a college degree. I mean, how can you think that your government allowed or allowing these things to happen to a person?
In 1907, Indiana had become the first of more than 30 states to pass sterilization laws, and some of those laws stayed on the books well into the 1970s. In fact, the state of Oregon did its last sterilization in 1981 and did not abolish its eugenics board until October of 1983.
Some states practice sterilization without ever creating an official eugenics board. In those instances, few if any records were kept. And in the states that did keep records, many have never been made available to the public. But in just those states that have released their records, it is known that at least 60,000 Americans were sterilized, and they were disproportionately black.
Do you think attempts like these to limit our population ended with civil rights reforms in the late 60s? Well, think again.
In a July 7, 2009 New York Times Magazine interview, Justice Ruth Bader Ginsburg said, "Frankly, I thought that at the time Roe was decided, there was concern about population growth, and particularly growth in populations that we don't want to have too many of."
Today, in 2009, there are those who still want to control the growth of what they term as an undesirable population.
John Holdren, President Obama's science czar, co-authored a textbook in 1977 which discussed and advocated totalitarian measures to curb population growth. These plans included forcing single women to abort their babies or to put them up for adoption, implanting sterilizing capsules in people when they reached puberty, and spiking water reserve and food with chemicals that would make people sterile. We must rise up and stop racism in all forms. We must join together and determine that decisions about our health care be left to us and our families, and not to the bureaucratic elites in Washington. Join us today and oppose a nationalized healthcare system. We must make sure that what happened to Elaine Reddick will never happen to another woman again. Say no to nationalized healthcare.